Good day and welcome to UroNurse News. I'm Vic Senese. Today we're highlighting new clinical trial data that could meaningfully improve quality of life for men undergoing treatment for prostate cancer. Hot flashes. They're one of the most common and often underestimated side effects of androgen deprivation therapy, or ADT. Up to 60 to 80% of men receiving ADT experience hot flashes. These episodes don't just cause discomfort. They disrupt sleep, interfere with daily activities, and significantly reduce overall quality of life. Now, a new study published in the Journal of Clinical Oncology suggests that an unexpected medication, Oxybutynin, may offer sustained and significant relief. So what is Oxybutynin? It's an anticholinergic medication most commonly prescribed to treat overactive bladder. Somebody that's been around as long as I've been around, that was the old go-to med. But researchers have increasingly questioned whether its effect on the nervous system could also help reduce vasomotor symptoms like hot flashes. And according to this new phase 2 trial, the answer appears to be yes. So let's talk about this study. The study, known as Alliance A222001, was conducted by the Alliance for Clinical Trials in Oncology. Researchers enrolled 88 adult men with prostate cancer who were receiving ADT and experiencing what they described as bothersome hot flashes. The qualified participants had to report at least 28 hot flashes per week, symptoms lasting 2 weeks or longer, an ECOG performance status of 0 to 2, and a life expectancy of more than 6 months. Now, participants were randomized into 3 groups: 2.5 milligrams of Oxybutynin twice a day, and 5 milligrams of Oxybutynin twice a day, or placebo. Treatment lasted 6 weeks. So what was the primary endpoint? Well, the primary outcome was reduction in hot flash scores, which combine how often hot flashes occur and how severe they are. And the results were clear. Hot flash scores. At 6 weeks, the placebo group saw an average reduction of 4.85 points. The 2.5 milligram Oxybutynin group improved by nearly 10 points, and the 5 milligram group improved by almost 14 points. Let that sink in. The 5 milligram dose showed a statistically significant benefit with a p-value of 0.002. Even more notable, improvement began within 1 week, peaked by week 4, and was maintained through the end of the study. That's huge. Hot flash frequency also dropped significantly compared to placebo. The 2.5 milligram dose reduced hot flashes by nearly 5 episodes per day. The 5 milligram dose reduced them by almost 7 episodes per day. 5 milligrams twice a day is the usual dose for that drug, in case you're not familiar with it. That's a meaningful difference for patients dealing with daily symptoms. Quality of life and daily interference. Researchers also measured how much hot flashes interfered with daily life using hot flash-related daily interference scale. The 5 milligram dose, patients showed improvement in 8 out of the 10 quality of life domains, including sleep, mood, work, social activities. The 2.5 milligram dose improved 3 out of 10 domains. Patients reported distress from hot flash was also significantly improved, but only at the 5 milligram dose. Not surprising, that's the normal dose. Now, safety is always key, and here the findings were reassuring. There were no grade 3 adverse events related to Oxybutynin. A small number of grade 2 events occurred in both treatment arms. Most common side effect? Yep, dry mouth. And that's been always the big complaint with this drug, is the dry mouth. So other treatments like megestrol, medroxyprogesterone, and gabapentin can also help reduce hot flashes, but they're not as effective for every patient and may carry bothersome side effects themselves. This study provides strong evidence that Oxybutynin, familiar and widely available medication, may offer a non-hormonal, well-tolerated option for managing ADT-associated hot flashes. And I can tell you, for the guys out there suffering, this is going to be huge. So researchers concluded that Oxybutynin provides a consistent, clinically meaningful benefit for men receiving ADT. This research was supported by the National Cancer Institute, and some authors reported conflicts of interest. Details are available in the original publication. This article originally appeared on Cancer Therapy Advisor. For UroNurse, I'm Vic Senese. Hope you've been enjoying my choir, because here they come again. But first, tomorrow on UroNurse News, what if a simple brain game could protect your brain from dementia for up to 20 years? Tomorrow on UroNurse News, I break down eye-opening research showing how a specific type of brain training may reduce long-term dementia risk. Why this isn't just another gimmicky app. If you care about your memory, independence, and aging well, you don't want to miss this one. For UroNurse News, I'm Vic Senese, and here comes that choir.